All right, Dr. Fisher here. Today we are going to cover the feelings wheel. This is another well-requested item in the office to have an explanation as to what it is and how to use it. So when you think about health, when you think about wellness, most people think of the traditional medical system and the drugs or the surgery that they offer you to reduce the symptoms that you're experiencing. That's not really wellness per se, that's going to be disease care and management. So when you're looking at the underlying aspect of who you are as a person, what's actually happening to you, it's important to understand that an important part of you and or a really essential piece of information that you get from your own body is going to be your actual emotions. Emotions, if you break it down, emotion. It's the energy in motion. It gives you information. Usually we feel emotions in our body, throughout our body. We usually have more of like that logical headspace kind of up here in our head. And so it's really, really helpful when you're trying to get well, when you're trying to understand what's happening to you, when you're trying to understand the language of symptoms, to be able to have a really cool tool like this to be able to help you identify what the underlying issue is that's going on with you. So the feelings wheel is set up in a couple of different ways. You can see on the outside here, there are feelings when your needs are met and feelings when your needs are not met. It's going to be similar to when you're not eating, this is going to be what happens when you don't get fed for a while. Or when you're eating and you're being fed for a while, this is going to be the symptoms that you're experiencing. So it's just as important to understand the feelings and emotions in relationship to health and wellness on either side of the spectrum. And then down here at the bottom, what you can see is feelings are going to be those emotions inside of your body. They give you information, right? And so it's different down here to see the emotions related to things that are happening inside of you, like feelings of being abandoned, attacked, abused, betrayed. So those are some of the ones that kind of go more of like internally, they give you information about, hey, this may not necessarily be okay. So again, what you want to do as you look at this is, for example, if we feel some of those emotions down here that are related to feelings when your needs are not met, what you do is you come into the center. And in the center here, you might feel angry, right, that someone abandoned you, for example. Or you might feel disgusted that somebody attacked you or abused you or somebody that you know about. You might feel surprised or sad or ashamed. Oftentimes in culture, we push people by shaming them. And so what it does is then you go outward here and you say, okay, so that ashamed feeling that I'm feeling, that self-judgment, do I feel humiliated, embarrassed, guilty, or awkward? Okay, so I might feel awkward. And then a subsidiary of that is then I'm now left with this feeling of self-consciousness and I'm uncomfortable, right? And so those pieces of information then give you kind of a baseline of where you are and how to interact with yourself. And then the goal here would be to be able to interact with yourself with a form of self-compassion. If you need a little help from there, Kirsten Neff, selfcompassion.org, that will be a great follow-up to this particular chart. Great tool. They have a great assessment tool to go on there and see how well you're doing with these emotions. But this is kind of the general idea how this chart is laid out, and it really makes a huge difference if your goal is health and wellness. This is Dr. Fisher signing out.